Hi, welcome to Health Matters. I'm Rosie Smith, your hostess for today's show. The health information matters that most to you and your family. Thanks for watching. Today we have a very exciting lineup of bright, young, soon-to-be doctors as part of the FSU College of Medicine third-year rural track program under the direction of Dr. Steven Spence, who's the local site director. So to my left, to your right, let me introduce to you Jason Waldman. He's from Tallahassee, Florida. And to his right is our hometown girl from Sneads, Rachel Pelt. And then we also have Tucker Rutherford from Bonifay. And last but not least, we have Jared Barber from Bristol. Welcome to today's show.
Thank you, Rosie.
All right, well, it's always very exciting to have a brand new set of students, and each year Jackson Hospital's Rural Track program is able to take 3 third-year medical students from Florida State University. Under the direction of Dr. Steven Spence, as we said, he shapes these students' curriculum so that way they have an actual hands-on experience at the same time that they're also partaking in distance learning studies with the College of Medicine. Each of our students spend their entire third year right here at Jackson Hospital in beautiful Marianna, Florida. So let's start with you, Jason. Tell us a little bit about why you wanted to be a doctor.
Well, I was sick a lot as a kid, and my pediatrician made me feel safe and explained a lot of medical, scary-sounding terms and very easy to understand terminology. And I also have a brother who is mentally ill, and his interaction with the mental health and psychiatric fields solidified my desire to want to be a physician.
Well, that is very inspiring. Yeah, well, good luck with your future. We're really excited about that.
Thank you, Rosie.
All right, so Rachel is on our medical stipend with Jackson Hospital, so she's going to talk to you a little bit about that. But first, let's get to know Rachel more. Rachel, what made you want to become a physician?
Well, I've always loved people. I've always loved working with people, and I wanted to help people when I grew up. And as a child, I actually had rheumatoid arthritis. So that kind of led me into the field of medicine and encouraged me to become a doctor and help other people.
Well, that is wonderful. So, Tucker, tell us a little bit about your aspirations to becoming a physician.
Well, my dad told me when I was little that I could be anything I wanted to be when I grew up after I went to medical school. And so I'm still trying to figure out what I want to be when I grow up. But going to med school, it's been tough and everything, and I'm very happy. But I'm still really trying to figure out what exactly I want to do. But I'm happy being here.
Well, we are glad to have you now. You're 2 counties over, but is your father in medicine, or what made him kind of set that goal for you?
I guess he was interested in going into medicine. He only got his bachelor's degree in biology and did some work for like Space Science Services back in the day. But he just, I don't know, just kind of set that for me, jokingly, I guess. And later in about the 5th grade, I said, I think I want to be a doctor, and I just never changed my mind. Yes. So I ended up here, so I'm pretty happy. Yeah.
Well, we are glad to have you. All right, so Jared, tell us a little bit about what drove you to become a physician.
Well, just growing up in Bristol and then really this surrounding area, I understand the huge need for physicians.
Right.
And people's, I guess I would call it apprehension, or just a lot of people don't desire or feel the need to go to a physician, and I want to go back and change that, because there's a lot of, I've even had family members and know a lot of other people that just because they didn't desire or feel the need to go to see a doctor, that their stages of life had already kind of passed them, and if they had went earlier or felt comfortable going, it could have benefited them in the long run. So, but the reason I wanted to go was mainly due to the need. I know there's a huge need in this area.
Yeah, there is, and that is really admirable to be able to break down some barriers, because people are afraid of the medical community. It's very misunderstood, and I think sometimes patients feel like perhaps that they don't have their choices anymore, that somebody else is at the helm and it's their life. So we're going to talk a little bit about that later on. Before we get too carried away, I want us to talk a little bit about Rachel Pelt and her being on the Jackson Hospital Medical Stipend Program. Rachel, tell the viewers a little bit about what that stipend is and what it's doing for you to help pursue medicine.
The stipend actually helps me get through medical school, so it assists me with my tuition and my other expenses through medical school. And once I complete my training, I will return to Jackson Hospital to practice medicine.
Well, and we will be delighted to have you too. So that is wonderful. We're glad you're on the stipend program. So, Jason, tell us a little bit about the type of medicine that you might be thinking of now that you've been in your third year and you've kind of gone through a couple of rotations already. So what are you thinking?
I'm sort of divided in a couple of fields that catch my eye for different reasons. I like the fast pace of emergency medicine. I like that there is a set number of hours that goes along with it. I like pediatrics because I like kids. Kids are awesome. And you get to do a jack of all trades, but for kids type of thing where you get to treat the whole body. And I'm thinking about psychiatry simply because of my love for psychopharmacology and also because of my experience with psychiatry. The mental health field definitely needs more psychiatrists.
Yeah, there definitely is a big push for making that much more accessible to everybody's mental health services. So Rachel, what are you thinking?
Well, right now I'm actually thinking I want to be an OBGYN. I really have a passion for women's health, and I want to be there for those special moments when a first-time mom gives birth to her new baby, and to watch families grow and celebrate that with the patients.
Excellent. Well, Jackson Hospital, viewers, has about 500 new residents born right here at Jackson Hospital every year. We are one of only 2 statutory rural hospitals in the entire state of Florida that still has OB services. So that's very remarkable. We are licensed for 100 beds, and we are the closest hospital in the greater region that still offers OB services. So I think that is wonderful. We'd love for you to pursue that and have you come right back here and practice.
I'd love to do it.
All right. So Tucker, what are you thinking?
Well, really it depends on which one of my attendings is asking at the time.
Got to play the politics.
Exactly. So I haven't closed the door on really anything, but I like the complexity of internal medicine, but I also like kids. So being a family physician and being able to go back home to Bonifay one day, I could see myself doing that. I'd be happy doing that.
Yeah, that'd be awesome. All right. So Jared, what about you?
And I'm mainly looking at family medicine. I haven't closed the door, but I enjoy elderly and all the way down to kids. So mainly family medicine. And then, as Jason said, ER. As a family medicine, I could do some shifts in the ER as well. So I kind of like a little bit of everything. And I want to be able to treat the family as a whole. I like to, you not only know a grandmother, but her kids, and then the grandchildren. I kind of like treating the family as a whole, and you get to know them, and it's kind of special seeing that kind of bond that a physician has with the entire family, and have even seen it in multiple generations. So most likely family medicine.
Excellent. Okay, so we have a whole lot of different variety right here with your experience. So Tucker, tell us a little bit what it was like day one when you got to Jackson Hospital and you were on your first rotation.
Well, of course, the first day is always the scariest because you have no clue what's going on. You don't really know what the expectations are.
Right.
Because we work with 5 different attendings at once instead of like our colleagues across the state are dealing with 1 attending at once and one set of expectations. So the first week was definitely one of the hardest weeks. But once you get into it, I mean, it's great. The food here is awesome. It's like one of the best parts. So,
yes.
But I'm very happy being here. Everyone is lovely, very nice, very helpful.
Excellent. All right, Rachel, what was it like for you, your first day, like coming back here? Because you'd been in the community, people know who you are. So what was the reaction with patients saying, I know you?
I was still a little nervous, as Tucker said, because, we weren't familiar with where to go and what to do, and we were a little nervous, first day jitters. But at the same time, it was like coming home. I was actually born at Jackson Hospital. My mother worked here for 32 years. So I saw a lot of familiar faces and, a lot of people I've known and who have watched me grow up through the years. So it was kind of like a reunion for me.
Well, welcome home.
Thank you.
Welcome home indeed. All right. So how about for you, Jason? What was like, you're the one person that's not really from a rural area. You're kind of our big city third-year student. So what was it like coming to Marianna?
Well, it was like Tuck said, very difficult on the first day to step in and just be thrown in the midst of everything. 2 years of med school prepares you for some basic sciences and pathology, but it doesn't prepare you for real-world medicine. And especially for me, because I have never really been in a rural setting before, it was a real eye-opener to see the difference between the hustle and bustle of a big city like Tallahassee and a place like this where they don't even have a Chick-fil-A. But I actually found myself really liking the rural population in general. They're a lot more respectful on average than the patients I've seen in the first 2 years in a big city type environment. They are a lot more accommodating to the third-year students. They say, do what you need to do, get what you need to get done. And we get to learn a lot out here being one-on-one with attendings with third-year versus others that have to go through the hierarchy of the fourth year and the resident and the chief resident. We get a lot more hands-on learning. I think it produces a lot more productive doctors.
Absolutely. Well, welcome to Marianna. We're glad to have you. So, Jared, tell us a little bit about your current rotation is with the OBGYN. So have you delivered some babies?
Yes, ma'am. I think I've delivered 5 at this point.
Congratulations.
And still have, we have about 8 or 9 weeks left before we switch. But like Tucker said, we're with, the 5 different physicians, so it's kind of a busy day, and you have to worry about getting prepared for the next day. But overall, after, the first few weeks or so, things settled down, and I think everything's going pretty well. But this was kind of like home for me as well. I have some experience working at the hospital there in Bluntstown, Calhoun Liberty Hospital, and as a ward clerk, so I kind of knew the hustle and bustle of a busy day in a hospital. So this was like coming home to me. I just wanted more experience with rural medicine because that's what I want to practice.
Absolutely. Well, one of the distinguishing factors, and Jackson Hospital's was one of the first rural track sites with FSU College of Medicine, simply because we have all the specialties except for psychiatry. And I know y'all get your psychiatry rotation elsewhere, but it's kind of a unique position. Small hospital because we do have OBGYN and we have general surgery and we have an ICU at the hospital. We have all those different kinds of specialties. So Tucker, tell us a little bit about like what a week in your life is. You said you have 5 different physicians. Explain that to our viewers, what you mean by that.
So, so for example, I wake up on Monday, and my Monday morning is spent at Dr. Stephen Spence's office for internal medicine. And so I come to the hospital around in the morning on like my surgery and internal patients, and then I go to the office, work with him, and then usually spend the rest of the day with him. On Tuesday and Wednesday, I have surgery. So Tuesday I'm in the OR. Wednesday morning I'm in the clinic doing like pre-op, post-op stuff. And then we have D3 or Doctoring 3. It's like a lecture. It's basically to make sure we're doing what we're supposed to be doing Wednesday afternoons. We all
right here in this room, right? We're in your classroom actually.
Yep. And then Thursday, 1 week I'm in Dothan doing outpatient psychiatry, and the next Thursday I'm in Bonifay with Dr. Bailey doing family medicine.
Fantastic.
And then Friday mornings I rounded off with Dr. Bossy in pediatrics, and so it literally is doing something different just about every day, and you got to be on the ball. You got to keep up with everything, keep up with your notes, keep up with the different specialties. It's quite something.
That is like almost a traditional kind of rotation with the college classes. Your Monday, Wednesday, Friday classes are different than your Tuesday, Thursdays, except yours is changing daily.
Right. We're working 40 plus hours a week in the hospital and the clinic, and then going home at night and using the rest of our time to study. And so it's something different.
Yeah.
So tell us what it's been like for you to have, because when we see you guys, we and girls, we usually think, oh, you're just here you're truly like an internship almost. But you really have coursework as well. So Rachel, what are you working on in your coursework?
Well, for every rotation, like surgery, internal medicine, pediatrics, family medicine, psychiatry, we have certain assignments that we are required to turn in as well. And we also have an exam that we have to take for every rotation. So, when we're not working those 40 plus hours a week, like Tucker said, we are studying for those exams. We're doing our projects. We're, putting what we did that day into the computer so we, get credit for that. We have a lot of schoolwork on the side. So when we're not here in the hospital working, we're doing that.
So life is full.
Oh, very full.
Life is full.
Very full.
So, Jason, what has been your favorite rotation thus far? You talked a little bit about your interest in peds and maybe psychiatry, but what all have you done? Have you done everything? The internist, family practice, peds, surgery? Have you done it all now?
Well, in this program, we spend all year round going through 4 of our 6 rotations.
Okay.
And the other 2 are done based on a half-year schedule. So I'm in the half year of OBGYN right now, and then when November comes around, we're going to switch to the other side. So I'll become surgery and these guys will become OBGYN. My exposure to the rotations has been very positive thus far, and I think probably my favorite, simply because of all of the free reign that I get, the abilities that I get to learn and practice, is probably peds. Because my attending Dr. Bossy just sends me in the room, says, okay, go see the next patient, go do what you need to do, come back, tell me a story, present the case.
Oh, good.
And it is very immersive. I actually even have to write on the chart, like the paper charts that some offices still have, about what my subjective, objective assessment and plan is. And he'll strike out the parts he doesn't like, he'll sign the parts he likes, and I'm ultimately on his official charts. And I say, do I need to do this over? He's like, no, I'll just strike it out. So it is actually being contributory to the process rather than just being a shadow like we maybe have been for the last 2 years.
Yeah, that is really exciting. I mean, you're
is.
really doing doctoring now.
Yeah.
Under the supervision of your licensed doctor. All right. Well, what else would you like to tell our viewers about the third-year Rural Track program and maybe yourselves individually? Do you have anything else you'd like to share with our viewers today?
If y'all see us, tell our attendings that we've done a fabulous job.
Ask for the cell, Tucker.
Yes.
Yeah.
Well, and I'm sure all of you are just so grateful for the Mariana and Jackson County community, the wider region that extends down to Bristol and Calhoun County and that area, Holmes, Washington counties, for allowing our students to be a part of your care plan. It's a great opportunity for you viewers to see and experience young superstar physicians in the making and helping them with their training, and also for your accepting the physicians to help care for you. I think it is a win-win for the community, and it certainly is the win-win for our students, because as you heard them say today, it's not just that they're observing, they're actually doing hands-on care right now. So they will be that much farther ahead, and we hope that all of you would consider coming back to a rural area and practice medicine. I think we have 3 out of the 4 that are for sure. And if you have any questions about the FSU College of Medicine Rural Track program, be sure you stop by and say hello to Dr. Stephen Spence and ask him a little bit more about that. We are always looking for gracious people in the community to come out to the receptions when we have the changeover in May. And again, this is now our 11th year associated with FSU College of Medicine. So go Noles, and we're out of time now. Thanks for watching.
You're watching Chipola College Television.